Friends, today we will discuss about how gallbladder looks on ultrasound. As I have already told, gallbladder having three parts: fundus, body and neck. Fundus of gallbladder is the dependent part of gallbladder. Neck of gallbladder drain to cystic duct. Cystic duct joining with common hepatic duct to form CBD or common bile duct. Common bile duct after joining with main pancreatic duct drain to sphincter of body. This is the normal biliary anatomy. Now discuss about longitudinal section and transverse section image of gallbladder. How gallbladder look like on longitudinal section and transverse section. Remember some points to recognize a gallbladder on ultrasound. First point, shape of the gallbladder. The shape of the gallbladder is pear-shaped on longitudinal section, but in transverse section it is rounded or oval in shape. Second point, normal gallbladder has single, thin, bright echogenic wall, thickness having less than 3 mm. Third point, due to presence of clear fluid inside or clear bile inside, it looks jet black in color, that is purely anechoic. Fourth point, due to presence of clear bile inside or clear fluid inside, it having posterior acoustic enhancement due to less beam attenuation. Fifth point, it is surrounded by homogeneous hepatic tissue. It is one of the important points to differentiate it from duodenum, where it is next to liver. Sixth point, it having no peristaltic activity. Seventh point, gallbladder neck lead to or point to right portal vein along main lobar fissure. Eighth point, that is last point, exclamatory mark or exclamatory point. Collectively, gallbladder, main lobar fissure and portal vein have an appearance of exclamatory mark, which will be discussed in latter part of this video. Look at the slide. On the left side, it is longitudinal coated where it is pear-shaped, but in right side, it is transversely coated where it is oval or rounded in shape. Gallbladder surrounded by thin echogenic bright wall where thickness is less than 3 mm. Gallbladder look anechoic or purely jet black in color. Gallbladder having posterior acoustic enhancement due to less beam attenuation. Gallbladder surrounded by homogeneous liver tissue having no peristaltic activity. One of the important points to recognizing the gallbladder is the gallbladder neck point to or lead to right portal vein through main lobar fissure. Another important point is exclamatory mark or exclamatory point. Collectively, gallbladder, main lobar fissure and portal vein, all three structures have an appearance of exclamatory mark or exclamatory point. These are the points to recognizing a gallbladder on ultrasound. You have to remember these 8 points only. Now come to how gallbladder is measured. Remember, while taking longitudinal section, the probe marker should be towards the patient head. While taking transverse section, the probe marker should be towards the right side of the body. Length of the gallbladder and width or diameter of the gallbladder is measured in longitudinal section. But in case of transverse section, thickness of the gallbladder and width or diameter of the gallbladder also measured. Remember, again I am telling, length of the gallbladder and width or diameter of the gallbladder is measured in longitudinal section. But in case of transverse section, thickness, width of the gallbladder also measured. Normal gallbladder length is up to 8 cm. When it is more than 10 cm, it is abnormal or distended gallbladder. Normal width of gallbladder is 3 to 4 cm. More than 5 cm, it is abnormal or distended gallbladder. Now come to thickness, which is measured in transverse section. Less than 3 millimeter is normal. 3 to 4 millimeter is borderline. More than 4 millimeter is abnormal. Remember, again I am telling, length of the gallbladder is measured in longitudinal section. Thickness of the gallbladder is measured in transverse section. But width or diameter is measured both in longitudinal and transverse section. This slide showing right portal vein and main lobar fissure. Right portal vein will lead to or point to gallbladder neck through main lobar fissure. What is main lobar fissure? Main lobar fissure is a thin echogenic line or thin bright line in between gallbladder neck and right portal vein. This slide showing exclamatory mark or exclamatory point, which is the important mark to recognize a gallbladder on ultrasound. Collectively, gallbladder, right portal vein and main lobar fissure, all three structure appear as a exclamatory mark or exclamatory point. Remember, exclamatory point is the important landmark to recognize a gallbladder on ultrasound. This slide shows the neighboring structure where kidney, inferior vena cava and portal vein are situated. This slide shows Mickey Mouse view of portal triad, where face itself is a portal vein, and right ear is CBD, that is common bile duct, and left ear is hepatic artery. These three structures form Mickey Mouse view of portal triad. See the neighboring structure of gallbladder where they are situated. Inferior vena cava, aorta, gallbladder, liver, where they are situated. These are the important landmarks you should remember while recognizing a gallbladder on ultrasound. Thank you. Thanks for watching.